Good afternoon, dear participants of the conference. Today I would like to talk about features of the heart rate variability in rhinosurgical patients. Deviated septum is one of the main causes of chronic nasal obstruction and accounts for about 30% of all elective surgeries performed in the ENT hospital. In modern rhinology, there is no consensus on the tactics of postoperative management of patients who have undergone rhinosurgical interventions. There is no standard optimal postoperative management scheme that determines the duration of tamponade or its replacement with alternative methods of caring for wound surfaces and the necessity for local or systemic use of drugs. Information available in the literature on these issues is often contradictory. Despite the proposed and widely used methods of treatment of this disease, the problem of rehabilitation of patients who underwent a nasal corrective surgery remains unresolved. An objective and prompt assessment of the severity of the condition is an important but not finally resolved problem. There is a methodological approach based on the assessment of adaptive reactions, their identification in response to various aggressive factors, including surgical intervention. In this regard, the analysis of the heart rate variability is carried away, the indicators of which reflect the state of the regulatory systems of the body and the degree of their attention in response to various pathological factors. The undeniable advantages of this method are the possibility of multiple measurements, continuity of observation, and non-invasiveness. However, there is not enough data on the features of the heart rate variability changes in rhinosurgical disorders. The purpose of the scientific research is to develop a methodology for predicting and identifying the early postoperative period in patients with deviated nasal septum and vasomotor rhinitis to determine the functional state of the autonomic nervous system. It is known that the value of cardio intervals periodically changes due to the influence of parasympathetic, sympathetic, and higher autonomic centers of the pacemaker. The physiological meaning of the spectral analysis of the heart rate variability is that it evaluates the interaction of individual levels of heart rate control. The higher the level, the greater the amount of information is mass processed, the longer the oscillation period or lower frequency associated with its activity. Therefore, oscillation with a very low frequency reflect the influence of high autonomic centers and the cerebral cortex on the heart rhythm. Low frequency oscillations of the sympathetic divisions of the NS and high frequency oscillations of the parasympathetic. In healthy person, the ratio is determined to be 30, 30, and 40%. Under supervision, there were 85 patients, 42 women and 43 men aged from 15 to 55 years old, with combined curvature on the nasal septum and vasomotor rhinitis. All patients underwent inpatient treatment in the ENT department of the Ivanovo Regional Clinical Hospital. All underwent surgery in the form of submucosal resection of the nasal septum and submucosal vasotomy of the inferior 2 minutes under anesthesia. To assess the regulatory function of the autonomic nervous system, heart rate variability was studied. The technical basis of the method was the polyspectrum the third device, which provided ECG input, the second lead, and a personal computer Pentium, the third, 600 and 60 MHz. The studies were carried out on patients in a separate room. The software was intermingled by the polyspectrum program, which includes mathematical analysis of heart rate according to Bayevsky, and a specialized package for measuring heart rate variability developed by Neyrosoft. Produced activation of the program Polyspectrum. A card was created in the computer database for each patient, in which data about the patient, information about the disease, date and time of the study were entered. ECG recording and cardiointervalogram recording were simultaneously observed on the computer monitor screen in real time. Performed spectral analysis of heart rate variability assessment of the heart rate was using Fourier transform in accordance with the agreement of the European Association of Cardiology and the North American Association of Rhythmology and Electrophysiology. The following indicators were determined: heart rate, three spectral components calculated from 5-minute recording, very low frequency, and high frequency. The heart rate variability indicators made it possible to assess the initial functional state of the body and its adaptive capabilities based on the determination of the parameters of individual links of autonomic neurohumoral regulation and autonomic balance. The technical result of the proposed method lies in the possibility of predicting the type of course of the postoperative period by highlighting the indicators of very low frequency, and high frequency. At a ratio of very low frequency, and high frequency is 35, 25, and 40%, and unfavorable course of the postoperative period is predicted, and a ratio of 25, 35, and 40% favorable. A relationship has been established between the change in the tone of the autonomic nervous system, recorded according to the data of the heart rate variability, and the dynamics of postoperative reparative process in the nasal cavity and the restoration of its functions. The initial indicators of the heart rate variability recorded before endoscopic septoplasty make it possible to predict with a high probability the nature of the course and the postoperative period in patients with curvature nasal septum. A method for predicting the course of the postoperative period has been developed. Thank you for your attention.